Welcome to the panel From Pixel to Patient. That's our uniting topic for this conference, actually, and it kind of the topic of all the three medical AI conferences I've been to this week. There was the Helmholtz AI conference just the days before, and on Monday in Erlangen, Andreas Meyer and colleagues had the BAIOSPHERE medical conferences. And there it was Professor Jürgen Schüttler, the former dean or director of the medical health center, the clinic there, said a phrase which was, "Our patients motivate us every day to do better." And this kind of hit me, because this is a powerful reminder that it's about people. It's about technology, it's about AI, but it's also about people in healthcare. I don't need to tell you, but for me it was remarkable. AI can, as we heard throughout the day, help us detect diseases earlier. It can support doctors make better decisions. It can accelerate research, and technology suddenly becomes tangible when it's about humans. And this is amazing. You can improve lives, you can save lives. And this is what our panel will be all about: technology and research for the better of the people. And to go on that journey, I'm very happy to welcome our three panelists today. Our first guest is Julia Schnabel. She's a professor at TUM and founding director of the Institute for Machine Learning in Biomedical Imaging at Helmholtz Munich. She works on the forefront of medical imaging, multimodal AI, and foundation models for medicine. We have Carsten Marr. He's a founding director of the Institute of AI for Health at Helmholtz Munich and professor at LMU. Carsten works on using AI to better understand disease and translate discoveries into clinical practice. And Jan Wöpking, our third guest, he is the founding managing director of the Munich Medicine Alliance, M1. And Jan's role is to connect Munich's leading universities, there are at least 2 leading universities in Munich, hospitals and research institutions, and accelerate innovation and translation. And together they kind of represent the full patient journey from research to translation and to patient. So give a hand for the 3 panelists in the beginning. Julia, what do you think? What is the most exciting developments in AI and medicine at this moment?
Well, for me, the most exciting bit is that everything is starting to come together. I mean, when I started in this field, I was just doing image analysis and then a bit of AI. Now we just start seeing images as just one data point, not just the static data point, but just it's one of the temporal data points of a single patient, of a cohort of patients, and with all the other background that we have about patients, like Lisa Adams said before, it's you have to look at the whole patient history, and you have to look at the context of the patients, their family history, their environment, all these things. So it becomes so interdisciplinary that it takes, well, not just a village to build these foundation models. It takes all of Bavaria at least to get in that direction. And we start not just process the data, we start discovering new things. Mm-hmm. So we really start seeing causality in diseases. We start linking things up across scales, right from cellular pathological level all the way to population level. So we actually look at the big picture for change and can do this like deep dive as the room upstairs and can look at different angles all of a sudden. So I think it's been absolute transformational. The last 10 years, I think, have been quite a ride.
Mm-hmm. And is it, you said it's coming together right now. Is it really coming together, or is it a fight to really bring it together and to allow you to get the things together? I'm talking about privacy protection and stuff, and availability of data. When I go to see my doctor, it's pretty much still the cards they take out of the shelves, and they see when I've been there the last time and so on.
Well, it has been a little bit mentioned just by Bernhard Kainz, the two systems, NHS in the UK is also where I've been before, and the German slightly more bureaucratic system are quite different, but the governance and all these things are of course there. The infrastructure problems are there as well, how to get to the data. But I see, if you see things not just from the hospital point of view and the infrastructure point of view, but also from the patient point of view, I think there's lots of willingness in the population to actually start giving their data for research. So I think if you ask individual people, they would say yes. It's a bit like, you know, donating your blood, right? You want better treatment, you want help research, and that shift I think we see also happening. That's why I think these kinds of conferences where we are here now are so important, because it kind of highlights the need that we all have to pull together. So it is a struggle, but it is, I think, a very positive struggle right now, because it's an uphill struggle maybe to some degree, but we know what we need now, and we're asking also politicians the right questions, what they can actually help us to succeed in that struggle.
Mm-hmm. And AI becoming tangible in medicine, is that something you witness, that people are really open to give their data, they see the need? I mean, you might be critical when it becomes to whatever face detection or self-driving cars, but medicine is something different. Is this something you witness?
I think as soon as you're a patient,
Yeah.
you change your mind immediately. Or if you're
Yeah.
a relative of a patient, the carer of a patient, then you start seeing, that how important it is, right? And the problem is, if a lot of people are, healthy, and you don't think about your pension when you're young, right? You don't think about all these things. But as soon as you see somebody close to you affected, you think quite differently.
Yeah.
And health is the one thing we kind of don't enjoy enough while we have it. But afterwards, kind of a bit like your youth, right? Is afterwards you think, oh my God, I wish I had done something better. But I think that people start living more healthily, people changing their lifestyle a lot, right? Because we're monitoring ourselves all the time. So people are becoming more aware of how important an asset it is to us, right? And if you can reverse disease processes early enough, that adds to longevity. So you see it all over the news, right? People want a long, healthy life now. So I think that will give a societal shift right now. Right?
So Bernhard Kainz spoke about foundation models. I didn't hear all of his talk, and maybe so didn't you. Could you comment on this? Why do foundation models now become more and more important in medical research?
Well, as I start off with, I think interdisciplinarity is important. If I just look at a radiological scan, I need to know about other data points of the patient. And radiologists not just look at the image and kind of segment a tumor with their eyes. They know what they need to look for. They have the patient history there. If we just do image analysis, as I used to do, just looking at the image is not enough, because you have to see the patient behind the image, right? So you have to pull all the data together, and this is what foundation models try to do. They pull as much different multimodal data coming from different imaging sensors, from lab reports, from we call this the doctor's note, the doctor's letter in Germany, together, just to give a more complete picture. But if you do that across a bigger population, you start seeing patterns. So these models are not just a nice, convenient hold all for data, like a big data storage, because they go through this bottleneck to go this lower dimensional latent space. They learn a representation across a cohort, across a population, which you then can query, you can navigate through, and you can start asking the model, with the use of large language models, questions, right? And you can discover new patterns which you wouldn't see just from looking at images or at Excel spreadsheets or other things. It's actually in discovery mode for you. That's the hope.
That's the big benefit. Oh, we could continue for ages, but I forgot the men here on stage almost. So let's turn to Carsten. So we heard a lot about research, yeah? What is going on in AI research, foundation models? How does all of this get towards the patient, to what that you and I can benefit as a patient?
Right. So I think there are kind of three opportunities at least. One would be to mirror the human, right? Do what humans do at the moment, but do it quicker, more standardized, and ideally cheaper. The second opportunity we have, I guess, is using these systems to go beyond the human, especially when we have multimodal data, where our brain is limited in bringing things together. And then another thing would also be to take the systems that we have and use it for low resource settings, right? Bring it out of our health system into somewhere where experts are less present. And maybe I give an example from my research and also where we try to apply that. So every one of us is producing 200 billion of cells every day, sperm, for example, but also other cells like blood cells, in particular blood cells. And it's not just the number which is impressive, but the balance of cells that we produce. So we do just the right amount of red blood cells that carry oxygen, thrombocytes that close our wounds, neutrophils that kill bacteria, or T cells who patrol through the body to figure out if there's any unwanted cell somewhere, right? And also killing cancer very early. So we produce these cells in a perfect balance, and this balance is shifted whenever we have an inflammation or cancer, right? And we have a very cheap way to read that out, and this is blood, right? So you take a drop of blood, you smear it on a glass slide, you stain that, and then a cytologist looks at that and assesses the quality of your blood and finds diseases just from the shifted balance of cell types, or also from the emergence of cells that shouldn't be there. And now in that case, right, what we do at Helmholtz and LMU is training models who do just that, observing that slide as Bernard showed us, right, and using computer vision to identify single cells and do the counting and assessment of that slide. That would be option one, right? Do that quicker, easier, faster. More cheaply. And the second thing is combining things, as Julia said, right? Taking these information, but combining it with other modalities, for example, genetic readings, right? A human will fail to get the meaning out of 2 billion of our DNA samples if we sequence that, right? And then combining that with the history of a patient and other things. So bring that together would be the second thing. And then the third thing is training these models and let other people use it. We have a collaboration, for example, with researchers in Egypt who use our models to detect blood diseases or generate reports from pathological samples.
It sounds so good, yeah, that I can't wait to see it happen and to be rolled out everywhere. Cheap medicine available everywhere. Are there any bottlenecks, or where are the bottlenecks in this game?
Yeah, let's go back to Lisa's talk. I mean, if you go to the clinics, right, we don't see that. And I guess the bottleneck is the deployment, taking that models that we showed in research that they work and bring them to the clinics and really let people benefit from that. And I mean, writing a research paper, that's what we typically do, right? That this is one set of skills that you need, but translating that to the clinics, you need a couple of other skills that we typically don't have, and also the medical informatics people don't have, and this is software development, right? Dealing with regulation, making sure that we have a proper AI-human interface that works. So these are the things. Really bringing stuff to the clinic is where we currently still fail, and what we have to do now, I think.
So it's about talking to people from other disciplines, meeting people from other fields like we do here. You mentioned when we talked before the concept of the clinical AI consultants you have at Helmholtz. Can you talk about this for a second?
Right, so thanks to the Bavarian high-tech agenda, we have money, and we employ now 5 people as Helmholtz AI consultants. It's software developers, it's a medical AI expert, it's also an ethicist. And that team has the task to do that, to bridge from research to clinical application. And we have these people employed at Helmholtz, so you can imagine that it's not the easiest thing to get them into the clinics, right? To get their hands dirty with the data there, deploy the models, measure the effect of the models. And we try to do that by now looking for proof of concept cases where we can do that. And we very much hope that we find clinicians and people that help us doing that. And actually the Medical Alliance M1 is one of the things where we hope this will build the right environment to do that. Not just in one clinic, which can be hard enough, right? But ideally across the clinics in Munich and providing that kind of service to the Munich health ecosystem.
I talked over a dinner yesterday. I talked to a researcher from a private clinic in Germany. They said they have another place in Spain, and they're not able to transfer any data between these two places in the European Union. So once a person from here goes there, it's a completely new patient. The power of networks, the power of networking people. Jan, this is pretty much what you are doing in the M1 Medical Alliance. Can you tell us what you are doing and what's the purpose of your work?
Yeah, happy to, very happy to be here. So we're the new kid on the block here in Munich. The M1 Munich Medicine Alliance. It's a, let me say something about what we are, or what we try to do is, we're a foundation. That's probably the first thing to say. We're a public foundation. We get money by the States Ministry. We get a lot of political backing from the States Ministry. And our aim is, in the most ambitious form, to turn Munich into one of the globally leading biomedical and biotech hubs of the world. Luckily, there's no fixed date attached to this vision, so we might have a bit more than a year to do that. And our partners are, for now, the two leading universities, both among the very best universities we have on the continent of Europe. The hospitals, so Großhadern and Rechts der Isar, are both part of the alliance, and of course Helmholtz Munich. So you have 5 stellar, globally leading and globally visible institutions. And for the first time, not very much for the first time, but still kind of, actually I felt a lot of what you said before when you talked about AI coming together and positive struggle uphill. I felt a lot of similarities to actually what the situation here is. So it's a coming together of these institutions. It's not a merger, but it's a working together to join forces to be even more competitive in the field of medicine and biotech. And we cover the whole range from groundbreaking basic research to the clinical application. And that's why we're also very happy to support the AI consultants, because I think this is a perfect example of what is already there in Munich as a strength, the high competence in these issues, and at the same time the challenge, which is to bridge the gaps between the institutions, to reduce inter-institutional barriers, to get you to find data, clinical data, and patients, and to make what you do accessible for the patients in the hospitals. So this is basically what we do. Foster connections, strengthen what Munich is already very good at. Very specifically, what we do is we want to set up a Munich Clinical Trial Center. So one place in Munich where you can go to if you want to do a clinical study in Munich. And we also want to create a Munich clinical data center, which also helps the research and the work in AI, I hope very much.
So that would be a virtual entity, like a platform where you gather data, someone searches for something, someone offers
that's
something.
the idea. Yeah.
And it can be accessed by all clinicians, by all researchers from the relevant institutions?
Yeah, the idea is to make it accessible both for internal research and for the researchers of the institutions, and also in, of course, defined ways for industry partners. Mm-hmm. So, and the reaction that we get from industry is they have glowing eyes when we talk about one Munich data center.
And this is something you want to have realized by when? Can I ask that?
You can ask that. I won't be so careless as to say a specific date yet, I think, but very soon. We're starting. We're already starting this, and it's the speed, the pace is immense. And we want to get there as soon as possible.
So will that be the point of time also when patients practically benefit from that? Maybe a question to all of you. Once there is this platform set up and you put a case there, and it's a human being, or maybe a disease or whatever behind that. So is that the moment when this very patient will benefit from that platform?
I'll look to the practitioners here, to the experts.
I mean, we hope that with every installment of a AI model, patients will benefit, right? But having, for example, a data resource where we can look up a patient that is closest to a current case, right? What kind of treatment people got in the past, how did they react to that? This will help clinicians, of course, in order to make better informed decisions.
Yeah, but it is different to the electronic health data record. It's not every patient is captured in all their data and that because they still are part of different surgeries, go to a different hospital, not just the university hospitals in Munich, depending on, you know, what kind of treatment regime they're under. But it's going in the right direction, I think. And it will do a lot of things for research and building models from which other patients will benefit. That's the idea of this. Yeah.
And
I should also mention that we're working closely together with another initiative, which is called the Bavarian Health Cloud, which is doing a similar thing for the whole of Bavaria. And of course, there's also lots of activities going on the federal level. So that's my sense is there's a lot of momentum right now, a lot of energy. Also, as you said, for AI, the same holds for these institutional initiatives. I think so. A lot of hope, a lot of energy, and a lot of things that you'll see in the near future, I think.
That's also something I witnessed, that there's really ambitious people. There's quite some political commitment, as we heard this morning. But it's taking time. This Bavarian Health Cloud has, I think, taken us 4 years to set it up, which is good. It's now maybe up and almost running. What if you look maybe another 4 years ahead from now? What would you expect? And this can also be the closing round already when we come again here for the DLD 2030. What will you report will happen by then, and what will we have achieved by then? Anyone?
So I can start. I hope that by then we will all acknowledge that giving research access to our data helps us so much more than restricting access in closed silos, maybe also with a power idea behind that, right? So I guess we have to go beyond that and make sure that we acknowledge the power of these models and AI that we can only achieve if we can really leverage the information and the content that is in patient data.
So when I see a doctor, I know that this doctor is really making use of data, understands data, is being supported by AI, so I get a better treatment.
Yeah, also, I mean, even your own data, right? I mean, looking at your history in a very quick, efficient way will change things a lot, right? And even that is currently not possible, right?
Thank you. Julia, what do you think?
Well, as part of this Bavarian Foundation model, which we are now building over the next 15 months, minus 6 weeks. So we have a very quick turnaround here in Bavaria. I would hope that we have one large model which can be compartmentalized in more specific models and be deployed in hospitals for testing. I'd like to see this going also into primary health care. So if you go to a GP, Hausarzt in German, that they can actually match the patient, the incoming patient, to a larger model and find similar cases to help them select the better treatment, do comparisons, do a stratification of best treatment options for that patient, and start getting in there. So it takes a lot of education on both sides. We as more scientists need to learn the clinical demands. Clinicians need to learn what AI could do for them, that it will not make them redundant, but it will be kind of like a very trusted co-pilot, not meaning Microsoft here, but generally like a trusted, person in the not in the driver's seat, but next to them, holding their hand and being supportive. And I hope that patients, who are kind of the third arm in this, will also have trust in this. And there has to be a certain amount of education there as well. And this is what public engagement is all about. That they will see what AI can do for them. That it's actually a support model for them for their healthcare needs. And will help them also maybe to start preventing disease or detecting it really early.
Great, thank you. Yeah.
I have to confess, I'm hugely optimistic about the future. I know this is a strange thing to say.
It's
In
allowed,
these,
yeah.
it's still allowed. I hope.
Yeah, in Bavaria.
In Bavaria, certainly in Bavaria. I have to say, I came from Berlin to Bavaria, so this is definitely a change.
Exactly.
I wouldn't dare to describe what the world looks like and what Munich and Bavaria looks like in 4 years. I mean, when we look back 4 years, I don't know, was ChatGPT around 4 years ago? This is what the last 4 years have been like, and if we look now in the future, another 4 years, it'll just be incredible in so many ways. And I think with regard to Munich, I hope that we'll be seeing, and over the course of the next 4 years, the institutions working ever closer together, finding ways to make the most of their individual strength, and to turn this fantastic city in a even more competitive, more stellar ecosystem in medicine and biotech. And I think the potential is so huge, and I can't wait to see what's going to happen.
Cool. We're at ground zero. Time is over, but I think it was a great journey from pixel to patient. There's hope, there's optimism in Bavaria, hopefully also in Germany and Europe. Thank you very much, Julia Schnabel, Jan Wöpking, and Carsten Marr, and thank you all for joining us in discussion. Thank you.